Moving on to our next speaker. She is Dr. APOORVA Reddy. She is, just one second. She is an endodontist, a functional medicine clinician. She's working at Functional Medicine Clinic, Bangalore, along with Dr. Ashwini and Dr. Ruhi Agarwal. Adapt in properly diagnosing and curating personalized treatment plans based on functional testing. She's also experienced in counseling patients on preventive care and positive lifestyle changes. She's committed to provide patients with the best care possible that she can offer after diagnosing the root cause conditions in these patients. Her topic for today is role of metabolomics to hack your biology. Over to you,
Yeah.
Dr. Apurva. Yeah.
Yeah. Hello, doctor. Thank you.
Thanks.
Can I share my screen?
Yes, please.
Can you see it?
Yes, I can see it. Can you please maximize? Yes.
Great. Okay. Hello, everyone. I'm Dr. Apurva. Today, my topic of discussion would be metabolomics. Basically, it'll help you provide a comprehensive snapshot of how your body is functioning. So, I'm having difficulty changing it to the next slide.
Okay. Can you please unshare and share it again? Can you please do that? Or else I'll open it for you.
Okay, let me just try.
I'll just.
Yes, I can do it now.
Yeah.
Yes, so the objectives of my today's topic of discussion would be, one is to talk about the changing era of diseases. So basically how we are moving from an acute to a more chronic disease phase. What are functional disorders? How do they usually go undiagnosed? And what is root cause medicine, as many of us have already explained it. So what is metabolomics? We will be touching that in detail. What does it help in? And what comprehensive metabolomic panel test for? And how is it done? So as we can see, chronic diseases have reached epidemic proportions. It could be in women with respect to PCOD, autoimmune conditions, and in men, there's a rise in coronary artery disorders and neuropsychiatric disorders like Parkinson's and Alzheimer's. And also in children, we see obesity, allergies, and also spectrum disorders like autism on a rise. So as we can tell that when medicine is a system of how do we deal with illness, once the illness is already established, then our wellness system seems to be failing us, right? So what are functional disorders? These are disorders basically, which is one of medicine's, we can say, biggest failure because of lack of adequate testing. So these include abnormal changes in the structure and functioning of an organ. For example, in IBD, you see structural abnormal functioning of the gut. But your conventional testing and your conventional doctors won't be able to help you diagnose that. So rather, you'll just be taking supplements to just curb the acidity, etc. So basically, they cannot be tested. And also, these things do not include the multiple other triggering factors and the functional imbalance scores as we talk about them. So as you can see, this is a typical picture of the iceberg phenomenon. So we term diseases as diabetes, obesity, heart, fibromyalgia, etc., autoimmune. But what's happening underneath is something we have no clue about. That is high inflammation, hormonal imbalances. There is poor detoxification health. And also there's mitochondrial dysfunction, which we'll talk about today, and also gut disorders. So what would conventional versus functional medicine be? The approach in conventional would be recognizing these symptoms, formulate a diagnosis just based on these symptoms, prepare a plan to, as one of the doctors earlier was telling, like just suppress these symptoms and use surgery as the last resort. Whereas in functional medicine, we focus on the root cause of why you're getting what. We use these symptoms as a means to discover the underlying health issues. And also we develop a more holistic approach. So as I already said, it's a more proactive healthcare strategy where it will include prevention. These tests will help us be preventive with our approach, early detection. It can help in curating a personalized, individualized plan. We address the root cause in this manner. And also it will be a way in which you can take in charge of your own health, understanding how your body is functioning, where it's going wrong. So there'll be a lot of patient empowerment and education. So what is metabolomics? So it's one of the technologies, as the speaker earlier, also the doctor was saying, that it helps us have access to precision medicine. So basically, metabolomics is a study of all the biochemical processes that are happening at every cell in your body. So during these, like energy production, it could be metabolism of what you're eating, etc. So they are the small molecules which act as VIPs in the backstage, and they control our biochemistry. And also they give us insights into the health and disease states. So there are few markers which indicate health. There are few markers which indicate disease. So for example, some of the common metabolites in your body include amino acids, which are the building blocks of your muscles, nucleotides, which are the building blocks of your DNA, RNA, carbohydrates, and glutathione, as we were just discussing, one of the most potent antioxidant in the body. So this can look complex, but this is basically a chart which shows the fats, the carbohydrates, and the proteins that we consume. How are they metabolized? So all of them are metabolized to something called this acetyl-CoA, which then enters. So this is happening inside every cell in your body. This is how basically ATP, which is the energy currency, the fuel of your body, how your body creates this from the food we eat, etc. Right? So as you can see, there are multiple steps in each of these. There are over 20 steps here that happen in the cell. So these things, what you see here, malic, fumaric, succinic, pyruvic, all these are metabolites. So via metabolomic testing, we can identify these in your blood and urine. And based on this, we can figure out whether your body is functioning well or no. So a complex metabolomic panel will test for your energy production, if your vitamins, minerals, and your carbohydrates are getting metabolized well. It tests for your gut health, which is very important, how well your body is detoxifying, and also the neurotransmitter functions. So as you can see, nutrition deficiencies are a big epidemic nowadays. Basically, what our grandparents ate was much healthier than what we are eating today because of modern invasive farming, soil degradation, and also poor nutritional choices. We are reaching out to all the high sugar, high carb diets. So they usually go undiagnosed, and also because of which, so basically you have to understand that in your blood, you might be having enough vitamin B12. I see a lot of questions based on that also in the chat box. But at the cellular level, your body might not be uptaking it. So there are, WHO also has released that vitamin B12 is one of the global pandemic, which causes a lot of methylation issues like we were discussing. So it can lead to fatigue, memory, brain fog, depression, etc. And if you're often taking medications like birth control pills, your metformin, all of these also decrease the B12 in your cells. So as you can see here in this image, so this something called methylmalonic acid, it is high. So which indicates that there is a functional deficiency of B12 at the cellular level. So this is how we come to a conclusion of what's happening at the cellular level with respect to your vitamins and minerals. So minerals also are very essential in our body for a lot of things like electrolyte balance, strong bones, teeth, thyroid function, etc. Magnesium is another thing we test for using this test. So it's needed for over 300 enzymatic reactions in the body. So usually because of, again, modern ways of farming, so because of using pesticides which are loaded with potassium, the plants end up taking more of that, and there's generally a less magnesium available to all of us via our food chain. But apart from that, chronic stress, insulin resistance, consumption of excessive alcohol, kidney disease, all of these can lead to common symptoms which we see. So usually just with magnesium supplements, so many of our clients have relief in things like migraines, their brain fog improves, also chronic unexplained cramps and pains. So all of these are basically the deficiencies which cause the symptoms. So do you feel tired, anxiety, brain fog by the end of the day, or even in the middle of the day, you're low on energy? you seem to have gut issues, unexplained pain, and after exercise, you usually end up feeling tired instead of, recharged. So all of this can indicate a low energy production metabolism in your body. So as we already discussed, mitochondria, which is the powerhouse of our cell, as we learned in our biology, is where this ATP is generated from the nutrients we consume. And what is mitochondrial dysfunction? So mitochondrial dysfunction can happen because of various reasons. It's basically a situation where your body is not able to produce the energy to meet up for its requirements. And your body needs energy for everything, right? And also you experience chronic fatigue, muscle weakness, cognitive issues. And we see mitochondrial dysfunction as one of the root causes in major chronic disorders like Alzheimer's, your epilepsy, obesity, autism. All of these have that core root cause of mitochondrial dysfunction as a reason. And what causes mitochondrial dysfunction? It's basically buildup of stress. It's just like how when we are stressed, we can't function. The same thing happens inside the cells in your body. Because of exposure to toxins chronically these days, because of poor nutrition, low nutrient status, because of unwanted viral bacterial overgrowth in the body. All of this leads to the mitochondrial dysfunction, which eventually leads to increased aging, immune function is poor. It can even lead to metabolic dysfunction like diabetes, obesity, etc. And how do we use metabolomic testing to identify these, whether our mitochondria is functioning well or no? So usually clinically, these things can become difficult to diagnose because, these symptoms like fatigue, migraines are correlating with so many other disorders. But then with this test, we can check for the specific stress markers like your oxidative stress markers like lactate and citrate, and your antioxidant status like CoQ10, alpha lipoic. As you can see here in this section of the test, it shows CoQ10 is in borderline. And lipoic acid, which is another potent antioxidant needed for good functioning of the mitochondria, is also in the borderline. So in these cases, we help the body by supplementing these till we again fix the deeper root causes. So how do we help mitochondrial dysfunction? As I said, we would support them with nutritional antioxidant therapies. We would facilitate elimination of toxins by eating a healthy diet, chelation, encourage lifestyle changes like intermittent fasting. The problem is we are eating throughout the day, but that's not how our body is supposed to be functioning, right? We need to give a gap between 2 meals in order for the body to do the rest of the work. And also more patient-specific approaches like fixing the nutritional deficiencies, etc. Gut. Now, they say gut is our second brain. It harbors around 100 trillion microbial cells. And I think as we were also discussing earlier today, we have more of the bacteria have an expression in our genetic material than even our own. So they have an effect on your physiology, on your metabolism, your nutritional absorption, etc., and your immune function. So we have good and bad bacteria. So a gut dysbiosis is a condition where there's an overgrowth of the bad guys. So that leads to digestive issues like IBD, IBS, again, your insulin resistance, autoimmune conditions, inflammation, and also chronic fatigue syndrome, and even mood disorders. So your gut can have a direct impact on your brain and how you feel, because they say 70, 80, 90% of your serotonin is produced by your gut. So coming to the bad bugs. So as you can see here, Candida is one of the common things we see because of our increased intake of sugars, our rice. So there's an increase in Candida overgrowth in almost all of the people we see. So these are the specific markers which we can see are high when we see Candida overgrowth. Things like tartarate, oxalates. Oxalates are another huge problem. And also another bit difficult one to treat is this Clostridia bacteria overgrowth because of our increased abuse with antibiotics. So the bad bugs are basically taking over. It's time we take over. Yeah, and then this is an image of how you can see here, tartarate, right? 8 and 9. So this is a report of a client of ours who suffers from eczema. So eczema, psoriasis are often associated with candida overgrowth, yeast overgrowth. So as you can see, the marker is on the higher end. Both these are high. So yes, candida can manifest in different ways, from autoimmune conditions to just your skin and nail fungus infections, to cravings, mood swings, and increased seasonal allergies, etc. So once you figure out that you have maybe a candida overgrowth, we can do some antifungal treatment where we help you, of course, change your diet, where we are not feeding the bad ones. We are feeding the good bacteria with more complex carbohydrates like fiber, vegetables, etc. We also use some antifungal medicines. Natural herbs can be used. They're very potent in treating this, like oregano, garlic. Also, coconut oil, which has caprylic acid, is a very good antifungal agent. So I think all of us should just start using coconut oil in our cooking. And coming to, also we use some antifungal medications like nystatin and itraconazole, which work very well. And of course, we repopulate the gut with multi-strain good bacteria over there, especially things like S. boulardii, which help in combating candida overgrowth. Another thing is, of course, the gut and the brain connection. So as you can see, this is an image in which a leaky gut can lead to leaching of. So once the gut is not supposed to be leaky, it's just semi-permeable, allowing the things we need and just eliminating the things which we don't need. But when this chronic inflammation and heavy metal toxicities and heavy, yeast overgrowth, etc., they lead to something called leaky gut, which then starts leaching out all the toxins we are taking in via our food, and it goes into the bloodstream, and then it's a systemic inflammation, right? So then that even crosses the blood-brain barrier and affects our neurons and the brain functioning. So Clostridia, also prevents. So as you can see, these are two markers for Clostridia overgrowth, indole and 3-HP. They're very high. So these are the metabolites that are produced by this bacteria. So this bacteria is sitting there in your gut, metabolizing the food you're eating. And these metabolites in turn are affecting the functioning of your body. So basically that's what's happening. So as you can see here, dopamine, which is a neurotransmitter, is usually converted to also norepinephrine. But when this bad bug of Clostridia overgrowth is there, then the metabolites of these two things prevent the conversion of this dopamine to norepinephrine, because of which there is more dopamine. And as you know, the minute there's more dopamine, there's aggressiveness. It's a very hyperactivity we see in children. All of these things are associated with Clostridia overgrowth. So we can use some antibiotics in that case, because that is a little difficult to treat. And coming to amino acids, yes, proteins are very important, and they're needed for everything in the body, from your immune function to your enzymes, which we discussed in detail today, your hormones, growth in children, etc. And usually the deficiency of those can lead to bigger appetite, poor health, skin, nails, increased risk of infections, and even fatty liver, because the body is not able to detox. So as you can see, there is a panel in this where we even test for the protein intake status, which shows if it's adequate or not at the cellular level. And in here, you can see on the right side, all these amino acids like your glycine, cysteine, lysine, all of that are on the lower end of the spectrum. So, we need to increase these in the diet and also maybe supplement if needed. Coming to your carbohydrate and fatty acid metabolism, which is something we consume every day. So if that's not happening properly, again, there is a problem, right? So we see when these are impaired, there's increased lactic acid, there's increased citric acid, your ketones are out of place, and carnitine, as we just discussed, it's one of the most important things to produce energy also. So here's an image where you can see the carbohydrate metabolism is impaired, your glucose oxidation is impaired. So as you remember, there were multiple things that were needed as cofactors for this to happen properly. So even if things like magnesium is insufficient, this can be impaired, etc. So that's something we'll have to work on. And as you can see here, carnitine, which is needed in metabolizing fats and transporting it into the mitochondria, And so if that's not there, then your fats are not getting metabolized, and hence your energy production and overall your fat is low in the body. So coming to toxins, these are another unappreciated cause of diseases in all of us. As we have discussed in detail today, they act as endocrine disruptors. They're there in our food, they're there in our air, everywhere. So they act as endocrine disruptors. They can cause leaky gut. Aluminum is also very, very bad. It's there in our cooking vessels. And also it causes leaky gut. So it literally pierces through your intestines. It leaches itself into the blood, and then it either gets deposited in your fat tissues or it goes into the brain and causes calcification and other neurological problems. So it's one of the difficult things also to remove from the body. So yes, these toxic heavy metals can damage your body, increase the stress in your body. It's like an engine which is, it has something inhibited in it and it has to function with that stuck in it. So overall, it can lead to poor energy production. And we do test for some detoxification health markers like mandelic acid, pyroglutamic, and orotate. In this case, mandelic is usually seen. So nowadays, all of us are ordering from Swiggy. So everything is coming in plastic. So we are constantly getting exposed to these. And this is increasing in the body. So we can test for that and figure out how we can help the body detox, right? And also stop using those things. So, and also, as you can see, pyroglutamic acid, if it is high, it can indicate issues with the gamma glutamyl cycle. That indicates glutathione depletion. So the minute glutathione, which is like your master antioxidant in your body, which is detoxifying all the things we are taking in, it's protecting us from that. So if that's not enough, then again, the body is not able to function. And orotate is another thing we test for, which can indicate ammonia. So ammonia also is produced as a lot of byproduct in our body. And if that builds up, again, because of which there's fatigue, your poor brain functioning and all of that. So we can use things like arginine and some of the amino acids to help detox all of these things. And we can even support it with glutathione. So yes, as you can see, this is the detoxification health section. And you can see here glutathione is impaired. CoQ10 is, this patient has a lot of things going on. So basically we'll have to support. So the idea is just to understand what is going wrong in a very precisive, and it's in a very like individualized manner, and to curate a plan and curate a treatment plan that can support the body where it needs. So that's what this helps in. And yes, we can even facilitate detox by improving the protein intake, consuming sulfur-rich foods like your broccoli. We also do heavy metal chelation. Heavy metals is there in everybody. I don't think we even have to test for it anymore. That's what I've seen. And also we can use some potent antioxidants like your curcumin, your age-old curcumin, your NAC, selenium, vitamin E, C, and of course, nothing beats improving your exercise and your sleep. So how is this organic acid test done? So it's very simple. It will be sent to you in an envelope. Usually it's a dry test, what we say a dry test, dry blood spot test. So you'll have to collect the urine, the first urine sample before you eat and drink. And there'll be like a strip you have to just dip in it. And also for your blood, there'll be a paper which has these dots, circles, as you can see. So you'll just have to make a small prick. Of course, you sterilize and clean your hands, fingers, and then make a small prick and place it over there so that it can blot. And after which it can be dried in sterile condition, and then you just pack it and mail it. What are the conditions that could benefit from metabolomic testing? Well, anybody can. If you're looking at health optimization, or you're fixing your insomnia, fatigue, mood changes, nausea, gut issues, autoimmune conditions, if you're having inflammation, basically anybody can benefit from this. So my takeaway message today would be that acute care approach to chronic disorders is definitely not working out, and because we are not having the methodology and the tools to prevent them when we can prevent them and treat them in a more holistic manner. So metabolomics in that sense is a very comprehensive and holistic approach, and it can help us provide insights into the cellular. So basically what's happening at the cellular level in your body. And overall, we can improve the nutrient needs. You see where the antioxidants are deficient, your B vitamins, your minerals at the cellular level again. And also we will work on improving your gut health. So that is one of the core philosophies of functional medicine, gut health. And of course, we identify the toxins and also help detoxify. And of course, we work on improving your metabolism. It can be your fatty acids, carbohydrates, mineral, vitamin, etc. So it helps provide a unique nutrient demand targeted intervention. So overall, it's about conquering the causes of chronic illness for a healthier, longer, and happy life. Thank you.
Thank you so much, Dr. Apoorva Reddy, for letting us know what is metabolomics. Yes. So there are multiple questions in the chat box. The one thing that people are asking is, what is the costing of this test? Number one. Any idea on the same?
Yeah, the cost can range. So we have different profiles. There's something called oats, which is very more elaborate.
Yeah.
There's something called NutriFit, and we can specifically do it for different people. So the NutriFit would cost somewhere around 7,000, 6,000 to 7,000.
So is there one test for all the conditions or different profiles for different conditions? How do you go about it?
Two things that we use commonly in India. One is the oats. We are testing for more elaborate markers, whereas it will pretty much cover everything as well, what we need to work with. So that is more concise one, but it is good enough. So
how often, next question is very interesting one as well. How often do you suggest this? For example, if you diagnose something and you put the patient on supplements and other protocols, diet and nutrition, how often do you recommend this testing to understand what are the changes that have happened in the test or in the blood workup and the urine sample? Yeah.
So what we usually do is we test this. We recommend this for almost all our clients. So it's very helpful because it helps us have a very deep understanding of what's happening in the gut and has an impact on how we plan their protocol. So after 3 months, we see changes in their blood report, but we don't really recommend this again because it's pretty much, we get an idea, general idea. Around, I would suggest maybe 6 months. 6 months would be a good time to again maybe redo it.
Redo it and check it, what are the parameters that have changed or not. During the presentation, you talked about that we should not take frequent meals. There should be a gap. Yesterday also we had a session where doctor told that we should be under fasting. What is the timing that you suggest between 2 meals, and what could be the fasting that a person can go for better activity inside the gut as well and overall systemic effects?
I would say at least give a minimum of 4 hours. 4 hours is minimum. 4-5 hours without eating. Again, it depends on how many meals depends on what your physical activity is. That's what this is personalized. It's never like a one all for everyone. So if you feel your 2 meals a day, 1 at 12 and maybe your dinner at 7 is good. That is good. And maybe with some healthy snacking in middle if you feel like. But otherwise, we would suggest, if you still feel the need to do it because you have increased physical activity needs and etc., you just go for a bowl of soup or something in the night. But it's about minimal eating so that the body can start regenerating and rejuvenate also itself.
Thank you so much, Dr. Apoorva. Please stay back and answer some of the questions in the chat box as well. Okay? Yeah. Thank you. Thank you so much.